In terms of living with RA as a woman, probably the most significant issue that I've encountered in my life was around planning for pregnancy. So I have 2 children now, but the journey to have them was, pretty challenging, right? When I was, diagnosed as a teenager, right, my rheumatologist at the time had sort of given me the talk about, medication use, some of them not being safe or compatible with pregnancy is how a lot of the doctors will sort of put it. So I knew that, but then, once, life evolved and I found a partner and I was actually, seriously considering having a family, I, spoke with my rheumatologist again, all to find out that a lot of the medications that I take for my RA, we don't necessarily have the same amount of research or evidence out there to support their use during pregnancy. So I found myself in a position where I really needed to look at what I was taking, how long I might take it, during the pregnancy up to the, conception or having the pregnancy happen. It was sort of surprising and disappointing as a woman with RA to kind of discover that we didn't know as much as we should have about some of these medications. So it meant a lot of change in my treatment plan in the period before having kids, but as well during pregnancy. So trying to plan for the eventual flares that did happen, more so with my second child than my first, but just really quite happy that I had a rheumatologist who supported me through all of that and these very often uncertain decisions about things and, giving me a lot of good information about the, benefits, the risks, and where we stood. It was helpful not just for me, but for my partner because, at the end of the day, we're kind of making the decision together as a team.